Question 1. The audit findings indicate a persistent increase in Clostridioides difficile infections, CDI, on a surgical ward, despite consistent adherence to the facility's current Infection Prevention and Control IP manual, which was last updated 3 years ago. The IPC team is tasked with addressing this trend. Which of the following approaches best reflects the importance of research in infection control for resolving this issue? Option A. Initiate a cost-benefit analysis of all existing cleaning supplies and protocols, prioritizing the least expensive options that meet basic disinfection standards, assuming current practices are adequate. Option B. Rely on the collective experience of the ward's longest-serving nurses and physicians to identify potential causes and implement their most commonly suggested interventions. Option C. Conduct a thorough review of the latest peer-reviewed research and evidence-based guidelines specifically addressing CDI prevention in surgical settings, and use this information to inform potential updates to the ward's IPC protocols. Option D. Assume the increase in CDI is an isolated incident and monitor the situation for another 6 months before considering any changes to current practices. Correct answer is C. Conduct a thorough review of the latest peer-reviewed research and evidence-based guidelines specifically addressing CDI prevention in surgical settings, and use this information to inform potential updates to the ward's IPC protocols. Explanation. The audit findings indicate a recurring issue with healthcare-associated infections, HI, in a specific unit, despite the implementation of standard infection prevention protocols. This scenario is professionally challenging because it requires moving beyond routine adherence to established guidelines and necessitates a deeper understanding of the evidence base and emerging best practices. The challenge lies in identifying the root cause of the persistent HAIs and determining the most effective, evidence-based interventions. The correct approach represents best professional practice because it prioritizes the integration of current research into clinical practice. This aligns with the core principles of infection control, which demand continuous learning and adaptation based on scientific advancements. By actively seeking and evaluating research, infection control professionals can identify novel strategies, refine existing protocols, and implement interventions that are proven to be more effective in reducing HAIs. This proactive, evidence-based approach is ethically mandated to ensure patient safety and quality of care, and it is implicitly supported by regulatory frameworks that expect healthcare facilities to maintain high standards of infection prevention, often referencing adherence to evidence-based guidelines. An incorrect approach that relies solely on anecdotal evidence or personal experience fails to acknowledge the scientific rigor required in infection control. This can lead to the perpetuation of ineffective practices or the adoption of interventions that lack robust supporting data, potentially compromising patient safety. Another incorrect approach that dismisses the need for ongoing research and relies exclusively on outdated protocols ignores the dynamic nature of infectious diseases and the evolution of prevention strategies. This can result in a failure to adopt more effective methods, leaving patients vulnerable. Furthermore, an approach that prioritizes cost-effectiveness over evidence-based efficacy without a thorough analysis of the research supporting alternative, potentially more effective, but initially more expensive interventions can be ethically problematic and ultimately lead to higher long-term costs due to persistent HAIs. The professional reasoning process for similar situations should involve a systematic evaluation of the problem. This begins with a thorough review of the audit findings and patient data to identify trends and patterns. Subsequently, a comprehensive literature search should be conducted to identify relevant research on HAIs in similar settings or with similar pathogens. Critically appraising the quality and applicability of the research is crucial. This involves considering study design, sample size, statistical significance, and the generalizability of findings. Based on this evidence, a decision should be made regarding the modification or implementation of new infection control strategies, always prioritizing patient safety and adherence to established ethical and regulatory standards. Question 2. The risk matrix shows a high likelihood of microbial contamination on surgical instruments if sterilization processes are not consistently effective. Given the regulatory framework for healthcare facilities in the United States, which of the following actions best addresses this risk while adhering to established infection control standards and guidelines? Option A. Implement a comprehensive quality assurance program that includes regular validation of sterilization cycles, use of appropriate chemical and biological indicators for each load, meticulous documentation of all sterilization parameters, and ongoing staff competency assessments. Option B. Utilize a sterilization method that has been historically used in the facility without revalidating its efficacy for current instrument types or ensuring all components of the sterilization process are monitored. Option C. Rely primarily on visual inspection of instruments after the sterilization cycle to ensure they appear clean and free from debris, assuming the sterilization equipment is functioning correctly. Option D. Increase the frequency of sterilization cycles without verifying the effectiveness of each cycle or ensuring proper loading configurations, assuming more cycles will inherently lead to better sterility. The correct answer is A. Implement a comprehensive quality assurance program that includes regular validation of sterilization cycles, use of appropriate chemical and biological indicators for each load, meticulous documentation of all sterilization parameters, and ongoing staff competency assessments. Explanation: this scenario is professionally challenging because it requires the infection control professional to balance the immediate need for sterile instruments with the potential risks associated with inadequate sterilization. The Certified Professional in Infection Control (CPIC) certification implies adherence to U.S. regulatory frameworks, specifically those overseen by the Centers for Medicare and Medicaid Services (CMS), the Food and Drug Administration (FDA), and guidelines from organizations like the Association for the Advancement of Medical Instrumentation (AMI) and the Centers for Disease Control and Prevention (CDC). The core ethical and regulatory imperative is patient safety, which is directly impacted by the efficacy of sterilization processes. The correct approach represents best professional practice because it prioritizes patient safety by ensuring that sterilization processes are validated, monitored, and documented according to established standards. This aligns with regulatory requirements that mandate the use of validated sterilization methods and the implementation of quality control measures to confirm their effectiveness. Specifically, the FDA requires medical device manufacturers to provide validated sterilization instructions, and healthcare facilities are responsible for implementing these instructions correctly. CMS conditions of participation also require facilities to maintain sterile environments and processes to prevent healthcare-associated infections. AMI standards provide detailed guidance on sterilization processes, including the use of biological and chemical indicators, which are crucial for verifying sterilization efficacy. An incorrect approach that relies solely on visual inspection fails to meet regulatory requirements because visual inspection alone cannot confirm the destruction of all microorganisms, including resistant spores. This poses a significant risk of transmitting infections to patients, violating the fundamental ethical duty of do no harm, and failing to comply with CMS and CDC guidelines on infection prevention and control. Another incorrect approach that uses a sterilization method without proper validation or monitoring is also a regulatory failure. The FDA requires validated sterilization processes, and failure to adhere to these validations means the process may not be effective, leading to potential patient harm and noncompliance with FDA regulations regarding medical device reprocessing. Furthermore, using outdated or improperly maintained equipment, even if it's a recognized sterilization method, is a failure to adhere to manufacturer instructions for use and AMI standards, which specify equipment maintenance and calibration requirements to ensure consistent and effective sterilization. This directly compromises patient safety and violates regulatory expectations for quality assurance in sterilization. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with identifying the potential hazards, e.g., microbial contamination, device malfunction, assessing the likelihood and severity of harm, and then implementing control measures. For sterilization, this means selecting appropriate validated methods based on the device manufacturer's instructions and the type of sterilization required. It also involves establishing robust monitoring systems, chemical and biological indicators, regular equipment maintenance and calibration, comprehensive staff training, and meticulous documentation. When faced with a deviation or a potential compromise, the professional must immediately assess the risk to patient safety, halt the use of potentially compromised items, and implement corrective actions in accordance with established protocols and regulatory guidance. Question 3. Implementation of a new surveillance strategy for healthcare-associated infections, HI, requires careful consideration of data collection and analysis, which approach best ensures the effectiveness and efficiency of the surveillance program in identifying and responding to potential outbreaks and trends. Option A. Collect data on all reported infections, regardless of type or frequency, and analyze the raw data monthly to identify any statistically significant changes, without a predefined focus on specific infection categories. Option B. Prioritize the systematic collection and analysis of data for key indicators identified by national guidelines and internal risk assessments, focusing on trends in device-associated infections, surgical site infections, and C. difficile infection, with established protocols for timely investigation of deviations. Option C. Implement a comprehensive data collection system that captures every possible patient-related metric, with the expectation that a broad dataset will reveal all potential infection risks, and defer analysis until a significant number of data points have accumulated. Option D. Focus surveillance efforts exclusively on infections that have historically been the most prevalent in the facility, assuming that these will continue to be the primary concerns. The correct answer is B. Prioritize the systematic collection and analysis of data for key indicators identified by national guidelines and internal risk assessments, focusing on trends in device-associated infections, surgical site infections, and C. difficile infections, with established protocols for timely investigation of deviations. Explanation. The scenario presents a common challenge in infection control, balancing the need for timely and comprehensive surveillance data with the practical limitations of resources and the potential for data overload. Professionals must make informed decisions about which data points are most critical for identifying trends, outbreaks, and potential risks to patient and staff safety, all while adhering to established regulatory frameworks. The challenge lies in discerning signal from noise and ensuring that surveillance efforts are both effective and efficient. The correct approach represents best professional practice because it prioritizes the systematic collection and analysis of data directly relevant to the most significant infection control risks within the healthcare setting. This aligns with the principles of evidence-based practice and the regulatory requirements for robust infection prevention and control programs, which mandate proactive identification and mitigation of healthcare-associated infections. By focusing on key indicators and established protocols, this approach ensures that resources are utilized effectively to detect deviations from baseline, trigger appropriate investigations, and implement timely interventions, thereby protecting patient and staff well-being. An incorrect approach that relies solely on the most frequently reported infections, without considering their severity or potential for widespread transmission, fails to adequately address the most critical threats. This could lead to a delayed response to emerging outbreaks or a misallocation of resources. Another incorrect approach that involves collecting every conceivable data point without a clear analytical framework risks overwhelming the surveillance team, making it difficult to identify meaningful trends or actionable insights. This can result in missed opportunities for intervention and a less effective infection control program. A third incorrect approach that focuses only on historical data without incorporating prospective monitoring or emerging risk factors neglects the dynamic nature of infectious diseases and the need for continuous adaptation of surveillance strategies. This can leave the facility vulnerable to new or evolving threats. Professionals should employ a decision-making framework that begins with understanding the specific risks and priorities of their healthcare setting. This involves consulting relevant guidelines and regulations, identifying key performance indicators for infection control, and establishing clear protocols for data collection, analysis, and reporting. Regular review and refinement of the surveillance strategy based on emerging evidence and local epidemiology are crucial for maintaining an effective and responsive infection control program. Question 4. Compliance review shows a consistent pattern of suboptimal personal protective equipment, PPE, use among nursing staff in a high-acuity unit, including incorrect donning and doffing sequences and failure to change gloves between patient contacts. What is the most effective and professionally responsible approach to address this persistent issue? Option A. Increase the frequency of direct supervision by charge nurses and infection preventionists to observe and correct PPE usage in real time, without additional formal training. Option B. Distribute updated PPE guidelines via email and post them prominently in staff break rooms, assuming staff will review and self-correct their practices. Option C. Issue a written reprimand to all staff members observed not adhering to PPE protocols, with a clear warning of further disciplinary action for repeat offenses. Option D. Implement a mandatory, hands-on training session focusing on correct PPE donning and doffing, followed by direct observation and competency validation for all nursing staff in the unit, with a plan for ongoing reinforcement and feedback. The correct answer is D. Implement a mandatory hands-on training session focusing on correct PPE donning and doffing, followed by direct observation and competency validation for all nursing staff in the unit, with a plan for ongoing reinforcement and feedback. Explanation. This scenario presents a common implementation challenge in infection control, ensuring consistent and correct adherence to personal protective equipment, PPE, protocols in a dynamic healthcare environment. The challenge lies in balancing the need for strict compliance with the practical realities of staff workflow, varying patient acuities, and the potential for complacency. Careful judgment is required to identify the root cause of non-compliance and implement effective, sustainable solutions. The correct approach represents best professional practice because it directly addresses the observed deficiency through a multifaceted strategy that includes education, competency validation, and environmental support. This aligns with the principles of the Certified Professional in Infection Control (CPIC) framework, which emphasizes evidence-based practices and continuous quality improvement. Specifically, it reflects the regulatory expectation that healthcare facilities establish and maintain programs to prevent healthcare-associated infections, HI, which includes ensuring staff are adequately trained and proficient in infection prevention measures like proper PPE use. This approach is proactive, focusing on prevention and reinforcement rather than solely on punitive measures. An incorrect approach that relies solely on disciplinary action fails to address the underlying reasons for noncompliance, which could stem from a lack of understanding, inadequate training, or workflow barriers. This approach is ethically questionable as it punishes without providing the necessary support for improvement and may foster resentment rather than compliance. It also fails to meet regulatory requirements for effective infection prevention education and competency assessment. Another incorrect approach that focuses only on increased supervision without addressing education or competency validation is also insufficient. While supervision can identify issues, it does not equip staff with the knowledge or skills to correct them. This can lead to a cycle of repeated errors and a false sense of security if issues are merely observed but not rectified through skill development. This approach neglects the fundamental responsibility of the facility to ensure staff are competent in infection control practices. A third incorrect approach that involves simply reissuing PPE guidelines without any interactive component or assessment of understanding is unlikely to be effective. Guidelines alone do not guarantee comprehension or application. Without active learning, feedback, and verification of understanding, staff may continue to misinterpret or misapply the guidelines, leading to persistent noncompliance. This approach fails to meet the standard of ensuring staff are not only aware of, but also capable of implementing infection prevention protocols. The professional reasoning process for similar situations should involve a systematic approach. First, identify the specific nature and extent of the noncompliance through observation and data collection. Second, investigate the root causes, considering factors such as knowledge gaps, skill deficits, environmental influences, and organizational culture. Third, develop and implement targeted interventions, prioritizing education, competency validation, and environmental modifications. Fourth, monitor the effectiveness of interventions and make adjustments as needed, fostering a culture of continuous improvement and accountability. Question 5. The evaluation methodology shows an increase in specific healthcare-associated infections within a unit, prompting a review of environmental cleaning and disinfection protocols. The infection prevention team has identified that, while standard cleaning procedures are in place, there is a lack of consistent adherence to high-level disinfection protocols for shared equipment, and a perceived inadequacy in the frequency of terminal cleaning in isolation rooms. The facility is also facing budget constraints that may impact the availability of certain cleaning agents and staffing levels for environmental services. Considering the ethical imperative to protect patients and the regulatory framework governing infection control, Which of the following actions best addresses this situation? Option A. Suggests that the nursing staff take on increased responsibility for disinfecting shared equipment in their immediate patient care areas to supplement the environmental services team's workload. Option B. Recommend the immediate termination of the environmental services staff responsible for the affected unit, citing their failure to adhere to protocols as the primary cause of the HAI increase. Option C. Immediately implement a mandatory retraining program for all environmental services staff, focusing on high-level disinfection techniques and terminal cleaning procedures, coupled with increased frequency of environmental monitoring and audits of cleaning practices in high-risk areas. Option D. Propose a reduction in the types of disinfectants used to a single, cost-effective broad-spectrum agent, and advocate for a decrease in terminal cleaning frequency for isolation rooms to manage budget limitations. The correct answer is C. Immediately implement a mandatory retraining program for all environmental services staff, focusing on high-level disinfection techniques and terminal cleaning procedures, coupled with increased frequency of environmental monitoring and audits of cleaning practices in high-risk areas. Explanation. The evaluation methodology shows that a healthcare facility's environmental cleaning and disinfection protocols are under scrutiny following an increase in healthcare-associated infections. This scenario is professionally challenging because it pits the immediate need for effective infection prevention against resource constraints and staff workload. The infection preventionist must navigate ethical considerations related to patient safety, staff well-being, and organizational responsibility. Careful judgment is required to balance these competing demands while adhering to established standards. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based infection control. Implementing a comprehensive, risk-based cleaning and disinfection program, which includes regular audits, staff education, and appropriate product selection, directly addresses the root causes of HAIs. This aligns with the fundamental ethical obligation to do no harm and the professional responsibility to maintain a safe healthcare environment, as mandated by regulatory bodies overseeing infection control practices in the specified jurisdiction. An incorrect approach that focuses solely on cost reduction by using less effective disinfectants or reducing cleaning frequency would be professionally unacceptable. This would represent a failure to adhere to regulatory requirements for maintaining a safe environment and an ethical breach of the duty to protect patients from preventable infections. Another incorrect approach, which involves blaming frontline staff without investigating systemic issues in the protocols or training, is ethically unsound and professionally damaging. It fails to acknowledge the complexity of infection control and can lead to a demoralized workforce, hindering effective implementation of protocols. Relying on anecdotal evidence or personal preference for cleaning agents over scientifically validated products is also a failure to uphold professional standards and regulatory mandates for evidence-based practice. Professionals should employ a decision-making framework that begins with a thorough risk assessment, identifying high-risk areas and patient populations. This should be followed by a review of current protocols against established guidelines and regulatory requirements. Engaging stakeholders, including environmental services staff, nursing, and administration, is crucial for developing and implementing sustainable solutions. Continuous monitoring, evaluation, and adaptation of protocols based on data e.g., HAI rates, audit results, are essential for maintaining a high standard of infection prevention. Question 6. Market research demonstrates a growing concern among healthcare providers regarding the emergence of novel pathogens with unknown transmission dynamics. A facility has received preliminary reports of a new respiratory virus exhibiting rapid spread in a neighboring community, with initial descriptions suggesting high transmissibility and potential for severe outcomes in immunocompromised individuals. What is the most appropriate initial approach for the certified professional in infection control (CPIC) to take in this situation? Option A. Immediately implement universal respiratory precautions for all patients and staff, enhance environmental cleaning protocols, and initiate enhanced surveillance for respiratory symptoms, while simultaneously gathering more definitive information on the pathogen's characteristics and transmission. Option B. Focus solely on educating staff about general hygiene practices, such as hand washing, and advise them to report any unusual symptoms without implementing specific new protocols until more information is available. Option C. Wait for definitive laboratory confirmation and detailed epidemiological data from public health authorities before initiating any new infection control measures to avoid unnecessary disruption and resource expenditure. Option D. Proactively develop and implement a comprehensive isolation protocol for all patients presenting with any respiratory symptoms, regardless of their exposure history or severity, to err on the side of extreme caution. Correct answer is A. Immediately implement universal respiratory precautions for all patients and staff, enhance environmental cleaning protocols, and initiate enhanced surveillance for respiratory symptoms, while simultaneously gathering more definitive information on the pathogen's characteristics and transmission. Explanation: this scenario presents a professional challenge because it requires an infection control professional to assess the potential impact of a newly identified pathogen on patient care and facility operations without immediate, comprehensive data. The urgency stems from the need to implement protective measures to prevent transmission and safeguard vulnerable populations. Careful judgment is required to balance the potential risks with the disruption of standard practices. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based response aligned with established infection control principles and regulatory guidance. This involves leveraging available information, consulting with experts, and implementing a tiered strategy of containment and surveillance. This aligns with the core tenets of infection prevention and control, which emphasize proactive risk assessment and mitigation. As outlined in guidelines from relevant public health and professional bodies, the focus is on protecting patients and staff through informed decision-making. An incorrect approach that relies solely on anecdotal evidence or immediate, drastic measures without proper assessment fails to adhere to professional standards. Such an approach could lead to unnecessary panic, resource misallocation, and potentially ineffective interventions. It bypasses the critical step of understanding the pathogen's characteristics, transmission routes, and virulence, which are essential for targeted and effective control strategies. This demonstrates a failure to apply a systematic, risk-based approach to infection control, potentially violating ethical obligations to provide evidence-based care and regulatory requirements for diligent practice. Another incorrect approach that involves delaying any action until definitive laboratory confirmation is also professionally unacceptable. While confirmation is important, the absence of immediate action in the face of a potentially transmissible pathogen poses a significant risk to patient safety and public health. This inaction could lead to widespread transmission and outbreaks, violating the ethical imperative to protect vulnerable individuals and potentially contravening regulatory mandates for prompt response to emerging infectious threats. A professional decision-making process for similar situations should involve a rapid assessment of available information, consultation with infectious disease specialists and public health authorities, and the implementation of precautionary measures based on the most likely transmission routes and severity of illness. This iterative process allows for adjustments as more definitive data becomes available, ensuring a balanced and effective response. Question 7. Investigation of a patient presenting with fever, cough, and diarrhea in a long-term care facility reveals a need for immediate implementation of infection control measures. The patient has a history of recent hospitalization and has been experiencing these symptoms for 24 hours. The healthcare team is considering the most appropriate precautions to implement. Option A. Implement contact precautions for the diarrhea and standard precautions for the fever and cough, pending further diagnostic results. Option B. Implement droplet precautions due to the cough and fever and contact precautions for the diarrhea based on the presenting symptoms. Option C. Implement standard precautions for all patients and staff and initiate contact, droplet, and airborne precautions for this patient until a definitive diagnosis is made. Option D. Implement airborne precautions due to the cough and fever and reassess for other precautions if symptoms worsen. The correct answer is D. Implement airborne precautions due to the cough and fever and reassess for other precautions if symptoms worsen. Explanation: this scenario presents a common challenge in healthcare settings, ensuring consistent and appropriate application of infection control precautions when faced with a patient exhibiting symptoms that could indicate multiple modes of transmission. The professional challenge lies in balancing patient comfort and mobility with the imperative to prevent healthcare-associated infections. Hi, A hasty or incomplete assessment can lead to either over-isolation, impacting patient well-being and resource utilization, or under-isolation, posing a significant risk to other patients and staff. Careful judgment is required to accurately identify the most likely pathogens and their transmission routes, thereby selecting the most effective and efficient set of precautions. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment to guide the selection of appropriate precautions. This aligns with the fundamental principles of infection control, which emphasize understanding transmission pathways to interrupt them. Specifically, it reflects the guidance found in standard infection control guidelines that mandate the use of standard precautions for all patients and the addition of transmission-based precautions based on clinical assessment and diagnostic information. This approach is ethically sound as it protects vulnerable patients and healthcare workers while respecting patient dignity and minimizing unnecessary restrictions. An incorrect approach that relies solely on a single symptom without considering other clinical indicators or potential co-infections is professionally unacceptable. This failure to conduct a comprehensive assessment can lead to the selection of inadequate precautions, increasing the risk of transmission. For instance, if only airborne precautions were implemented for a patient with fever and cough, but without specific risk factors for airborne pathogens, and the patient also had diarrhea, the potential for contact transmission of enteric pathogens would be overlooked, creating a significant regulatory and ethical failure to protect others. Similarly, implementing only contact precautions for a patient with respiratory symptoms without considering the possibility of droplet or airborne spread would be a failure to adhere to established guidelines designed to prevent transmission of a wider range of pathogens. Over-isolation, while less likely to cause direct harm through transmission, can still be professionally problematic if it leads to unnecessary resource expenditure or negatively impacts patient experience without a clear clinical justification, potentially violating principles of efficient and effective care. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate standard precautions for all patients. 2. Conduct a thorough clinical assessment, considering the patient's signs, symptoms, medical history, and any relevant exposures. 3. Consult available diagnostic information or anticipate potential diagnostic results to inform the likelihood of specific pathogens and their transmission routes. 4. Select transmission-based precautions, contact, droplet, airborne, that are most appropriate based on the comprehensive assessment, prioritizing the most stringent precautions necessary to interrupt suspected or confirmed transmission. 5. Regularly reassess the patient's condition and the appropriateness of the implemented precautions, adjusting as new information becomes available. Question 8. What factors determine the most effective combination of infection prevention strategies in a healthcare setting, considering the principles of evidence-based practice and regulatory compliance? Option A. The perceived ease of implementation for staff and the cost-effectiveness of readily available supplies, assuming general infection control principles are understood. Option B. The latest trends in infection control literature, regardless of their proven efficacy or applicability to the specific healthcare environment and its regulatory context. Option C. The historical practices of the facility and the preferences of senior leadership, with a focus on minimizing disruption to existing workflows. Option D. The specific pathogens prevalent in the community, the types of procedures performed, patient susceptibility, and the availability of resources, all within the framework of established infection control, guidelines, and regulatory mandates. The correct answer is D. The specific pathogens prevalent in the community, the types of procedures performed, patient susceptibility, and the availability of resources, all within the framework of established infection control guidelines and regulatory mandates. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of infection prevention principles within the specific regulatory landscape of the Certified Professional in Infection Control (CPIC) exam. The challenge lies in selecting the most appropriate strategy when multiple options might seem superficially relevant, but only one aligns perfectly with evidence-based practice and the governing standards. Careful judgment is required to differentiate between general best practices and those mandated or strongly recommended by the specific regulatory framework relevant to the CPIC. Correct approach represents best professional practice because it prioritizes strategies that are demonstrably effective in reducing the transmission of healthcare-associated infections, high, and are supported by the foundational principles of infection control, as outlined by relevant professional bodies and regulatory guidelines. This approach emphasizes a multimodal strategy, integrating environmental controls, administrative policies, and individual behaviors, all of which are critical components of a comprehensive infection prevention program. Adherence to these evidence-based strategies is not only ethically imperative to protect patient safety, but also legally required by the regulatory framework governing infection control professionals. An incorrect approach that focuses solely on environmental cleaning, without considering hand hygiene or patient isolation protocols, is professionally unacceptable because it represents an incomplete and potentially ineffective strategy. While environmental cleaning is crucial, it is only one piece of the puzzle. Failing to address other critical transmission routes, such as direct contact or droplet spread, leaves significant gaps in infection prevention. This failure constitutes a regulatory and ethical lapse by not implementing a comprehensive, evidence-based approach to patient safety. Another incorrect approach that relies exclusively on staff education, without implementing robust surveillance or auditing mechanisms, is also professionally unacceptable. Education is a vital component, but without mechanisms to assess its effectiveness and ensure compliance, it becomes a theoretical exercise rather than a practical safeguard. This oversight can lead to continued transmission of pathogens, violating the ethical duty to provide a safe care environment and potentially contravening regulatory requirements for quality assurance in infection prevention. A third incorrect approach that emphasizes solely on the use of personal protective equipment, PPE, without addressing the root causes of transmission, such as inadequate hand hygiene or environmental contamination, is also professionally flawed. While PPE is a critical barrier, it is considered a last line of defense. Over-reliance on PPE without addressing upstream preventive measures can create a false sense of security and does not tackle the fundamental issues that lead to infections. This approach fails to meet the comprehensive standards expected of an infection control professional and can be seen as a failure to implement a proactive and holistic infection prevention strategy. The professional reasoning process for similar situations should involve a systematic evaluation of the available evidence, the specific patient population and setting, and the applicable regulatory framework. Professionals should begin by identifying the potential hazards and transmission routes. Next, they should consider a hierarchy of controls, prioritizing elimination and substitution, followed by engineering controls, administrative controls, and finally, PPE. Crucially, they must then cross-reference these potential strategies with the specific guidelines and regulations relevant to their practice and the CPIC certification. Continuous monitoring, evaluation, and adaptation of strategies based on surveillance data and emerging evidence are also essential components of effective infection prevention decision-making. Question 9. When evaluating the introduction of a new complex surgical procedure that carries a potential for increased risk of surgical site infections, which approach best guides the infection control professional in developing a comprehensive prevention strategy? Option A. Implement a comprehensive set of universal precautions for all staff involved in the procedure. Option B. Conduct a thorough risk assessment to identify specific hazards, analyze their likelihood and severity, and develop targeted control measures. Option C. Rely on historical data from similar, but not identical, procedures to anticipate potential infection risks. Option D. Gather informal feedback from surgical team members regarding their perceived risks and concerns. The correct answer is B. Conduct a thorough risk assessment to identify specific hazards, analyze their likelihood and severity, and develop targeted control measures. Explanation. Scenario analysis. This scenario presents a common challenge for infection control professionals, balancing the need for robust infection prevention strategies with the practical realities of resource limitations and staff buy-in. The introduction of a new, potentially high-risk procedure necessitates a proactive risk assessment to identify and mitigate potential hazards before they lead to patient harm or outbreaks. The professional challenge lies in accurately identifying the most significant risks and prioritizing interventions that are both effective and feasible within the healthcare setting. Correct approach analysis. A systematic risk assessment approach is the cornerstone of effective infection control. This involves identifying potential hazards associated with the new procedure, e.g., inadequate sterilization, improper aseptic technique, environmental contamination, analyzing the likelihood and severity of associated infections, and then developing control measures. This aligns with the fundamental principles of infection prevention and control, which are guided by evidence-based practices and regulatory expectations for patient safety. The CPIC certification emphasizes the application of such systematic processes to prevent healthcare-associated infections. This approach ensures that resources are directed towards the most critical vulnerabilities, thereby maximizing the impact of infection control efforts and fulfilling the professional obligation to protect patients. Incorrect approach is analysis. Focusing solely on historical data without considering the unique risks of a new procedure is a failure to adapt to evolving clinical practices. Historical data may not reflect the specific challenges or potential failure points of a novel intervention. This approach risks overlooking emerging threats and failing to implement necessary preventative measures, which is a direct contravention of the proactive nature of infection control. Implementing a broad, one-size-fits-all set of universal precautions without a targeted risk assessment is inefficient and may not adequately address the specific risks of the new procedure. Universal precautions are essential. A risk assessment allows for the identification of additional, procedure-specific controls that might be necessary, such as enhanced environmental cleaning protocols or specialized equipment. This approach lacks the precision required for optimal risk mitigation. Relying exclusively on anecdotal evidence or staff opinions without a structured assessment is unprofessional and unreliable. While staff input is valuable, it must be integrated into a systematic evaluation process. Decisions based solely on informal feedback can be biased, incomplete, and may not reflect the true nature or magnitude of the risks involved, leading to ineffective or misdirected interventions. Professional reasoning. Infection control professionals must employ a structured, evidence-based approach to risk assessment. This involves a multi-step process: hazard identification, risk analysis, likelihood and consequence, risk evaluation, and risk treatment. When a new procedure is introduced, the process begins with a thorough review of the procedure itself, its intended use, and potential points of failure. This is followed by an assessment of the likelihood of infection transmission and the potential severity of such infections. Based on this evaluation, appropriate control measures are then selected and implemented. Continuous monitoring and re-evaluation are crucial to ensure the ongoing effectiveness of these measures. Question 10. Benchmark analysis indicates a healthcare facility is investigating a cluster of post-operative wound infections. Laboratory reports describe the causative agent as a single-celled prokaryotic organism possessing a peptidoglycan cell wall, capable of binary fission for reproduction, and demonstrating susceptibility to penicillin. Based on these characteristics, which classification of microorganism is most likely responsible for these infections? Option A, fungus. Option B, virus. Option C, bacteria. Option D, parasite. Correct answer is C, bacteria. Explanation. Scenario analysis. This scenario presents a common challenge in infection control, accurately identifying and classifying a causative agent to implement appropriate control measures. The difficulty lies in the subtle yet critical differences between major classes of microorganisms, each requiring distinct strategies for prevention, treatment, and eradication. Misclassification can lead to ineffective intervention, potential outbreaks, and compromised patient safety, all of which have significant regulatory and ethical implications within the CPIC framework. Correct approach analysis. The correct approach involves recognizing that the described characteristics, a single-celled organism with a cell wall, capable of independent reproduction, and susceptible to antibiotics, are definitive features of bacteria. This accurate classification is paramount because it dictates the selection of specific antimicrobial agents, antibiotics, appropriate disinfection and sterilization methods for equipment, and targeted isolation precautions. Adherence to these principles aligns directly with regulatory requirements for evidence-based infection prevention and control practices, as mandated by bodies overseeing healthcare standards and patient safety, ensuring that interventions are both effective and compliant. Incorrect approaches analysis. One incorrect approach would be to classify the organism as a virus. Viruses are obligate intracellular parasites, lacking a cell wall and independent reproductive capabilities, and are not susceptible to antibiotics. Misclassifying a bacterial infection as viral would lead to the inappropriate use of antiviral medications, which would be ineffective, and a failure to implement antibiotic therapy, prolonging illness and increasing the risk of transmission. This represents a failure to adhere to evidence-based practice and could violate regulations concerning the provision of competent patient care. Another incorrect approach would be to classify the organism as a fungus. Fungi are eukaryotic organisms, distinct from bacteria in their cellular structure and reproductive mechanisms. Some fungi have cell walls. They differ significantly from bacterial cell walls, and they are not typically treated with antibiotics. Mistaking a bacterial infection for a fungal one would result in the administration of antifungal medications, which would be ineffective against bacteria, and a delay in appropriate treatment, potentially leading to severe consequences and regulatory noncompliance. A further incorrect approach would be to classify the organism as a parasite. Parasites are a diverse group of organisms, ranging from single-celled protozoa to multicellular worms. While some parasites are single-celled, their cellular structure, metabolism, and reproductive strategies are fundamentally different from bacteria. Treating a bacterial infection with antiparasitic agents would be ineffective and could expose the patient to unnecessary side effects, constituting a breach of professional standards and potentially violating healthcare regulations related to patient safety and appropriate medical management. Professional reasoning. In situations involving the identification of infectious agents, a systematic approach is crucial. Professionals must rely on established microbiological principles and diagnostic information. When presented with clinical or laboratory data describing an organism's morphology, reproductive capabilities, and susceptibility to treatments, the first step is to compare these characteristics against the defining features of major microbial classifications. This analytical process, grounded in scientific understanding, directly informs the selection of appropriate diagnostic tests, treatment regimens, and infection control measures. Professionals must continuously update their knowledge of microbial classifications and their implications for infection prevention and control, ensuring that all actions are aligned with current best practices and regulatory mandates to safeguard patient health and maintain public trust. Question 11. Strategic planning requires a comprehensive and adaptive approach to emerging infectious diseases and their impact on healthcare settings. Considering the dynamic nature of novel pathogens and potential public health crises, which of the following strategies best positions a healthcare facility for effective preparedness and response? Option A. Establishing separate, independent infection control plans within each clinical department, with minimal interdepartmental coordination, to address potential emerging infectious disease threats. Option B. Implementing a reactive strategy that focuses on acquiring necessary personal protective equipment and isolation, supplies only when a specific emerging infectious disease threat is imminent and confirmed. Option C. Relying primarily on historical outbreak data to inform current infection control policies, assuming that future emerging diseases will present similar challenges and require similar interventions. Option D. Developing a multidisciplinary task force to conduct ongoing surveillance, risk assessment, and scenario-based planning for a range of emerging infectious diseases, with clear communication channels and established protocols for rapid resource mobilization and adaptation of existing infection control measures. Correct answer is D. Developing a multidisciplinary task force to conduct ongoing surveillance, risk assessment, and scenario-based planning for a range of emerging infectious diseases, with clear communication channels and established protocols for rapid resource mobilization and adaptation of existing infection control measures. Explanation. This scenario is professionally challenging because it requires a proactive and adaptive approach to an evolving threat landscape. The rapid emergence of new infectious diseases necessitates continuous reassessment of existing infection control protocols and resource allocation. The challenge lies in balancing immediate needs with long-term preparedness, ensuring that strategies are both effective against current threats and flexible enough to address future, unknown pathogens. Careful judgment is required to prioritize interventions, allocate limited resources, and communicate effectively with stakeholders, all while adhering to established infection control principles and regulatory mandates. The correct approach represents best professional practice because it emphasizes a systematic, evidence-based, and collaborative strategy for managing emerging infectious diseases. This involves robust surveillance, risk assessment, and the development of flexible response plans that can be rapidly implemented. It aligns with the core principles of infection control, which mandate preparedness and a commitment to protecting public health. By integrating diverse expertise and fostering interdisciplinary collaboration, this approach ensures that preparedness efforts are comprehensive and effective, reflecting a commitment to patient safety and community well-being as mandated by infection control guidelines. An incorrect approach that focuses solely on historical data without considering the dynamic nature of emerging diseases fails to meet the standard of preparedness. This approach is ethically deficient as it risks leaving healthcare facilities vulnerable to novel pathogens, potentially leading to outbreaks and increased morbidity and mortality. It also violates regulatory expectations for proactive risk management and continuous improvement in infection control. Another incorrect approach that prioritizes immediate reactive measures without a strategic long-term plan overlooks the importance of building sustainable capacity. This reactive stance can lead to inefficient resource utilization and a lack of preparedness for sustained or widespread outbreaks. Ethically, it demonstrates a failure to adequately safeguard patients and staff against evolving threats. A third incorrect approach that relies on isolated departmental efforts neglects the critical need for a coordinated, facility-wide, and potentially community-wide response. Emerging infectious diseases transcend departmental boundaries, and a fragmented approach will inevitably lead to gaps in surveillance, communication, and response, increasing the risk of transmission and compromising patient safety. This is a direct contravention of best practices in infection control and public health emergency preparedness. The professional decision-making process for similar situations should involve a continuous cycle of assessment, planning, implementation, and evaluation. Professionals must actively monitor emerging infectious disease threats, conduct thorough risk assessments specific to their facility and patient population, and develop adaptable response plans. Collaboration with public health agencies, other healthcare facilities, and internal stakeholders is paramount. Regular training, simulation exercises, and a commitment to staying abreast of scientific advancements and regulatory updates are essential components of effective preparedness. Question 12. Governance review demonstrates a need for enhanced organizational oversight in patient safety initiatives. As a certified professional in infection control (CPIC), how should you prioritize your efforts in response to this review, considering the fundamental definition and importance of infection control? Option A. Allocate resources to updating all infection control policies and procedures to reflect the latest general patient safety guidelines. Option B. Initiate a comprehensive review of all existing infection control equipment for potential upgrades. Option C. Focus on strengthening surveillance systems and implementing evidence-based interventions for high-risk HAIs identified in the review. Option D. Develop a new patient education program on general hygiene practices without specific linkage to the governance review findings. The correct answer is C. Focus on strengthening surveillance systems and implementing evidence-based interventions for high-risk HAIs identified in the review. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an infection control professional to interpret a broad governance review and translate its findings into actionable infection control priorities. The challenge lies in discerning the most critical areas for intervention based on the review's outcomes, which may be presented in a general manner, and aligning these with the fundamental principles and regulatory mandates of infection control. Effective judgment is required to ensure that resources are directed towards the most impactful strategies for preventing healthcare-associated infections. Correct approach analysis. The correct approach involves prioritizing infection control efforts based on the identified risks and the established importance of infection control in preventing patient harm and ensuring regulatory compliance. This aligns with the core mission of infection control professionals, which is to protect patients and staff from infectious agents. By focusing on the definition and importance of infection, control its role in patient safety, operational integrity, and adherence to standards like those outlined by the CDC and OSHA, assuming U.S. jurisdiction for CPIC, the professional can effectively address the governance review's implications. This approach is best professional practice because it is evidence-based, patient-centered, and directly addresses the foundational purpose of infection control as a critical component of healthcare quality and safety. Incorrect approach is analysis, an approach that focuses solely on administrative tasks without linking them to direct patient safety outcomes or risk reduction, fails to grasp the fundamental importance of infection control. This is a regulatory failure as it neglects the primary objective of infection control, which is the prevention of HAIs, as mandated by regulatory bodies. It also represents an ethical failure by not prioritizing patient well-being, an approach that prioritizes new technology implementation without a clear assessment of its impact on infection rates or its alignment with identified risks from the governance review is also problematic. This is a professional failure because it deviates from a risk-based, evidence-driven approach. It may lead to inefficient resource allocation and fail to address the most pressing infection control needs, thus undermining the importance of infection control in a practical sense. An approach that dismisses the governance review's findings as irrelevant to day-to-day infection control practices is a significant regulatory and ethical failure. It demonstrates a lack of understanding of the interconnectedness of organizational governance and operational safety. Infection control is not an isolated function. It is integral to the overall quality and safety of the healthcare organization, and ignoring governance directives would be a direct contravention of the principles of accountability and continuous improvement expected of healthcare professionals. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the organizational context and its strategic priorities, as reflected in governance reviews. This should be followed by a thorough assessment of identified risks, particularly those related to infection prevention and control. The next step involves applying the core principles of infection control surveillance, prevention, education, and management to these risks. Finally, professionals must translate this understanding into prioritized, actionable strategies that are aligned with regulatory requirements and ethical obligations to patient safety. Question 13. The assessment process reveals a significant variation in the observed hand hygiene techniques among clinical staff, with some individuals demonstrating incomplete friction during rubbing and inadequate drying times. Which of the following approaches is the most effective strategy to address this implementation challenge and ensure adherence to best practices for infection prevention? Option A. Institute a disciplinary policy that outlines progressive disciplinary actions for any observed instances of noncompliance with hand hygiene protocols. Option B. Assign senior nurses to conduct informal peer observations and provide immediate verbal feedback to colleagues regarding their hand hygiene technique. Option C. Post updated signage in all patient care areas detailing the correct hand hygiene procedures and the importance of compliance. Option D. Implement a mandatory, hands-on training session for all clinical staff focusing on the correct steps of hand washing and hand sanitizing, followed by individual competency validation using a standardized checklist. The correct answer is D. Implement a mandatory hands-on training session for all clinical staff focusing on the correct steps of hand washing and hand sanitizing, followed by individual competency validation using a standardized checklist. Explanation. The assessment process reveals a common implementation challenge in healthcare settings, ensuring consistent and correct hand hygiene practices among diverse staff. This scenario is professionally challenging because hand hygiene is a cornerstone of infection prevention, directly impacting patient safety and the spread of healthcare-associated infections. Failure to adhere to proper techniques can lead to outbreaks, increased morbidity and mortality, and erosion of patient trust. The effectiveness of hand hygiene relies on both the availability of resources and the consistent, correct application of techniques by all personnel, regardless of their role or experience. Careful judgment is required to identify the root cause of noncompliance and implement sustainable solutions. The correct approach represents best professional practice because it directly addresses the identified knowledge gap through targeted education and skill reinforcement. This aligns with the fundamental principles of infection control and the regulatory framework that mandates ongoing education and competency assessment for healthcare personnel. Specifically, it reflects the guidelines from the Centers for Disease Control and Prevention (CDC) and the World Health Organization (WHO) on hand hygiene, which emphasize proper technique, appropriate product selection, and the importance of regular training and competency checks. By providing hands-on training and competency validation, this approach ensures that staff not only understand the why, but also the how of effective hand hygiene, thereby improving compliance and reducing the risk of transmission. An incorrect approach that focuses solely on punitive measures without addressing the underlying reasons for noncompliance is professionally unacceptable. This fails to acknowledge that errors in hand hygiene are often due to lack of knowledge, insufficient training, or environmental barriers, rather than deliberate negligence. Such an approach can foster a culture of fear and resentment, leading to superficial compliance or a reluctance to report errors, ultimately undermining the infection control program. It also fails to meet the ethical obligation to provide adequate training and support to staff. Another incorrect approach that relies on passive reminders without active skill development is also professionally deficient. While signage and posters can serve as prompts, they do not guarantee correct technique. Hand hygiene is a skill that requires practice and feedback. Without active training and competency assessment, staff may continue to perform hand hygiene incorrectly, rendering the practice less effective. This approach neglects the need for demonstrable competency, a key element in ensuring patient safety and regulatory compliance. A further incorrect approach that delegates hand hygiene training solely to frontline staff without oversight or standardized competency validation is problematic. While peer education can be valuable, it lacks the structured curriculum, standardized assessment tools, and accountability necessary to ensure consistent and accurate knowledge and skill transfer across the entire organization. This can lead to variations in practice and the perpetuation of incorrect techniques. The professional reasoning process for similar situations should involve a systematic approach. First, identify the specific problem through observation and data collection, as indicated by the assessment process. Second, analyze the root causes, considering knowledge deficits, skill gaps, environmental factors, and organizational culture. Third, develop targeted interventions that are evidence-based and aligned with regulatory requirements and best practices. Fourth, implement the interventions, ensuring adequate resources and support. Finally, monitor the effectiveness of the interventions through ongoing assessment and data analysis, making adjustments as needed to ensure sustained improvement in hand hygiene compliance and patient safety. Question 14. Cost-benefit analysis shows that investing in enhanced staff training on hand hygiene protocols and ensuring adequate supplies of personal protective equipment, PPE, for all patient care areas will yield a significant reduction in healthcare-associated infections. Given these findings and the need to optimize resource allocation, which of the following strategies best aligns with regulatory requirements and best practices for controlling pathogen transmission in a U.S. healthcare facility? Option A. Reducing the frequency of terminal cleaning for patient rooms to conserve resources, as most infections are acquired through direct patient contact. Option B. Discontinuing routine surveillance for specific pathogens and focusing only on outbreak investigations to manage infection control resources. Option C. Investing heavily in advanced air filtration systems for all non-critical care areas while scaling back on direct staff education regarding contact and droplet precautions. Option D. Implementing a comprehensive program focused on improving hand hygiene compliance and ensuring readily available PPE, alongside targeted environmental cleaning protocols for high-touch surfaces. Correct answer is D. Implementing a comprehensive program focused on improving hand hygiene compliance and ensuring readily available PPE, alongside targeted environmental cleaning protocols for high-touch surfaces. Explanation. This scenario is professionally challenging because it requires balancing resource allocation with the fundamental responsibility of preventing healthcare-associated infections, which are directly linked to modes of transmission. The healthcare facility is facing a budget constraint, necessitating a strategic approach to infection control interventions. Careful judgment is required to prioritize actions that will have the most significant impact on reducing pathogen transmission while remaining fiscally responsible. The correct approach represents best professional practice because it directly addresses the most critical modes of transmission identified by the Centers for Disease Control and Prevention, CDC guidelines, which are foundational to infection control in the United States. Focusing on hand hygiene, environmental cleaning, and appropriate use of personal protective equipment, PPE, targets the primary pathways through which pathogens spread in healthcare settings. This aligns with the principles of standard precautions and transmission-based precautions, which are mandated by regulatory bodies like the Occupational Safety and Health Administration, OSHA, and the Centers for Medicare and Medicaid Services, CMS, through their enforcement of infection control standards. Investing in these areas demonstrably reduces HAI rates, leading to better patient outcomes and potentially lower overall healthcare costs due to fewer complications and shorter lengths of stay, thus supporting a positive cost-benefit outcome. An incorrect approach that prioritizes less impactful interventions, such as solely focusing on advanced sterilization techniques for non-critical equipment without addressing fundamental hand hygiene, fails to adhere to the core principles of infection control. This would be a regulatory failure, as it neglects established guidelines for preventing common transmission routes. Ethically, it places patients at unnecessary risk. Another incorrect approach might be to reduce staffing for environmental services, which directly impacts the cleanliness of patient care areas and the disinfection of surfaces, a critical component of interrupting contact and droplet transmission. This would be a significant regulatory failure, potentially violating OSHA General Duty Clause to provide a safe workplace and CMS conditions of participation related to infection control. Ethically, it compromises patient safety by increasing exposure to pathogens. A third incorrect approach could be to discontinue staff education on infection control practices, particularly regarding airborne and droplet precautions. This would be a direct violation of regulatory requirements for ongoing staff training and competency assessment, and an ethical failure as it leaves staff ill-equipped to protect themselves and their patients. The professional decision-making process for similar situations should involve a thorough risk assessment of identified HAIs and their associated modes of transmission within the facility. This assessment should be informed by current CDC guidelines and relevant U.S. regulatory requirements. A multidisciplinary team, including infection preventionists, clinicians, and administrators, should collaborate to evaluate the cost-effectiveness of various interventions, prioritizing those that address the most prevalent and preventable transmission routes. Continuous monitoring of HAI rates and feedback on the effectiveness of implemented strategies are crucial for adaptive management and ensuring ongoing compliance and patient safety. Question 15. The control framework reveals a situation where a physician has prescribed a broad-spectrum antibiotic for a patient with a suspected but not yet confirmed bacterial infection, deviating from the institution's preferred agent for such indications. The infection control professional has reviewed the patient's chart and notes the potential for this choice to contribute to antimicrobial resistance and impact the patient's microbiome. The professional is considering how to best address this. Which of the following approaches best aligns with the principles of antimicrobial stewardship and professional infection control practice? Option A. Accept the physician's choice as a matter of clinical autonomy and make no further inquiry or intervention regarding the antibiotic selection. Option B. Immediately document the prescribing deviation in the patient's chart and report it to hospital administration without first consulting the physician. Option C. Initiate a direct, evidence-based discussion with the prescribing physician to explore the rationale for the chosen antibiotic and collaboratively review alternative, narrower-spectrum options that align with institutional guidelines. Option D. Override the physician's order and change the antibiotic to the institution's preferred agent, informing the physician of the change afterward. The correct answer is C. Initiate a direct, evidence-based discussion with the prescribing physician to explore the rationale for the chosen antibiotic and collaboratively review alternative, narrower-spectrum options that align with institutional guidelines. Explanation. This scenario presents a common ethical dilemma in infection control, balancing the immediate need for effective treatment with the long-term imperative of antimicrobial stewardship. The challenge lies in navigating patient care demands, physician autonomy, and the organizational responsibility to prevent antimicrobial resistance. A healthcare professional must act as a patient advocate while also upholding public health principles. The correct approach prioritizes a collaborative and educational strategy. It involves engaging the prescribing physician in a discussion about the evidence supporting the current antibiotic choice, exploring alternative agents with narrower spectra if appropriate, and reinforcing the importance of adhering to institutional guidelines and national recommendations for antimicrobial use. This aligns with the core principles of antimicrobial stewardship programs, which are often mandated or strongly recommended by regulatory bodies and professional organizations focused on patient safety and public health. Such an approach respects the physician's role while promoting evidence-based practice and the responsible use of antimicrobials, thereby mitigating the risk of resistance development and improving patient outcomes. An incorrect approach that involves immediately overriding the physician's order without consultation is professionally unacceptable. This demonstrates a lack of respect for the physician's clinical judgment and can damage the collaborative relationship essential for effective patient care and infection control. It bypasses established communication protocols and can lead to mistrust and resistance to future stewardship efforts. Ethically, it may also overstep the infection control professional's defined scope of practice. Another incorrect approach, which is to simply document the perceived inappropriate use without further action or discussion, fails to address the immediate issue and neglects the proactive role of infection control. This passive stance allows potentially suboptimal or resistance-promoting prescribing practices to continue unchecked, undermining the goals of antimicrobial stewardship and potentially contributing to the spread of resistant organisms. It represents a failure to intervene and educate, which is a fundamental responsibility of an infection control professional. Finally, an approach that involves escalating the issue to administration without first attempting direct communication and education with the prescriber is premature and can be perceived as adversarial. While escalation may be necessary in some circumstances, it should generally be a last resort after direct engagement has failed. This premature escalation can create unnecessary conflict and hinder the development of a positive, collaborative stewardship culture within the healthcare setting. The professional decision-making process for similar situations should involve a systematic approach. First, assess the situation based on available data and guidelines. Second, engage in open and respectful communication with the prescriber, presenting evidence and rationale. Third, collaboratively explore alternative strategies. And fourth, if consensus cannot be reached or the risk is significant, follow established institutional escalation protocols, always prioritizing patient safety and the principles of antimicrobial stewardship. Question 16. Risk assessment procedures indicate a consistent pattern of deviations from standard precautions during patient care activities, specifically related to hand hygiene and the appropriate use of personal protective equipment, PPE. The infection prevention team has limited resources for direct staff observation and education. Which of the following approaches best addresses this implementation challenge while adhering to infection control principles and regulatory expectations? Option A. Implement a targeted multimodal approach involving direct observation with immediate, constructive feedback, coupled with ongoing, role-specific education and competency validation. Option B. Develop and disseminate a revised policy outlining stricter consequences for noncompliance, with a mandatory annual review of the policy. Option C. Prioritize addressing the deviations only when a specific patient infection outbreak is identified. Option D. Focus solely on increasing the frequency of signage reminders throughout patient care areas regarding hand hygiene and PPE use. The correct answer is B. Develop and disseminate a revised policy outlining stricter consequences for noncompliance, with a mandatory annual review of the policy. Explanation. Scenario analysis. This scenario presents a common challenge in infection control, balancing the need for robust infection prevention measures with the practical realities of resource limitations and staff workload. The facility has identified a potential breach in standard precaution, but the proposed solution requires significant staff time and may disrupt patient care. The challenge lies in determining the most effective and feasible course of action that aligns with regulatory requirements and best practices without causing undue burden or compromising patient safety. Correct approach analysis. Implementing a targeted, multimodal approach that includes direct observation, immediate feedback, and ongoing education is the best professional practice. This aligns with the principles of continuous quality improvement and the regulatory expectation for healthcare facilities to maintain a safe environment for patients and staff. The Centers for Medicare and Medicaid Services, CMS, conditions of participation, for example, require facilities to have an infection prevention and control program that includes surveillance, prevention, and control of infections. A direct observation and feedback loop allows for real-time correction of deviations from standard precautions, reinforcing correct practices and addressing individual learning needs. Ongoing education ensures that all staff are up to date on current guidelines and protocols, such as those from the Centers for Disease Control and Prevention, CDC, for healthcare infection control. This approach is proactive, evidence-based, and addresses the root cause of the observed deviations. Incorrect approaches analysis. One incorrect approach would be to solely rely on a blanket policy change without addressing the underlying reasons for noncompliance. This fails to acknowledge that policy alone does not guarantee adherence and can lead to frustration and continued breaches if staff do not understand or agree with the rationale. It also neglects the need for individualized support and reinforcement, which is crucial for behavior change. This approach could be seen as a failure to implement a comprehensive infection prevention program as mandated by regulatory bodies. Another incorrect approach would be to implement punitive measures without first attempting education and support. This can create a climate of fear and discourage staff from reporting concerns or admitting to errors, potentially leading to more significant breaches being hidden. While accountability is important, a punitive approach without a focus on learning and improvement is not conducive to fostering a culture of safety and may violate ethical principles of professional development and support. It also fails to meet the spirit of regulatory requirements that emphasize education and performance improvement. A third incorrect approach would be to ignore the observed deviations due to perceived workload constraints. This is a direct violation of the facility's responsibility to maintain a safe environment and comply with infection control standards. It prioritizes convenience over patient safety and could lead to the spread of healthcare-associated infections, resulting in significant patient harm and regulatory penalties. This approach demonstrates a failure to uphold the core tenets of infection prevention and control and a disregard for regulatory mandates. Professional reasoning. Professionals should approach such situations by first conducting a thorough root cause analysis of the observed deviations. This involves understanding why standard precautions are not being consistently followed. Following this, a plan should be developed that incorporates education, direct observation, feedback, and ongoing monitoring. The plan should be realistic, considering available resources, and should involve staff in its development and implementation. Regular evaluation of the effectiveness of the interventions is crucial, with adjustments made as needed. This systematic and collaborative approach ensures that infection control measures are effective, sustainable, and integrated into the daily workflow, ultimately protecting patients and staff. Question 17. The control framework reveals that a healthcare facility is experiencing an increase in central line-associated bloodstream infections, CPIC. The infection prevention team is tasked with developing a new policy to address this. Which of the following approaches best aligns with the principles of effective infection control policy development and implementation within the Certified Professional in Infection Control (CPIC) framework? Option A. Implementing a policy based on the personal experiences and anecdotal observations of the most senior physicians in the intensive care unit, as their experience is considered invaluable. Option B. Developing a policy that mandates the use of a specific, expensive new product for central line care, without a thorough cost-benefit analysis or evaluation of its evidence base compared to existing practices. Option C. Reviewing the latest evidence-based guidelines from reputable organizations, consulting with frontline nursing staff who insert and manage central lines, and incorporating feedback into a draft policy that will be reviewed by the facility's Infection Control Committee before implementation. Option D. Creating a policy that focuses solely on hand hygiene compliance for all staff, assuming this will indirectly reduce CPIC without specifically addressing central line insertion and maintenance bundles. Correct answer is C. Reviewing the latest evidence-based guidelines from reputable organizations, consulting with frontline nursing staff who insert and manage central lines, and incorporating feedback into a draft policy that will be reviewed by the facility's Infection Control Committee before implementation. Explanation. The control framework reveals a common challenge in infection prevention and control: the need to balance evidence-based practice with the practical realities of implementation within a healthcare setting. Developing effective infection control policies requires a thorough understanding of current scientific literature, regulatory requirements, and the specific operational context of the facility. The professional challenge lies in translating this knowledge into actionable, sustainable policies that are both compliant and effective in reducing healthcare-associated infections, high. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and collaborative method for policy development. This ensures that policies are grounded in scientific validity, align with regulatory mandates, and are practical for staff to implement. Engaging stakeholders, including frontline staff, ensures buy-in and addresses potential barriers to adherence, thereby increasing the likelihood of successful implementation and improved patient outcomes. This aligns with the ethical imperative to provide safe patient care and the professional responsibility to maintain current knowledge and best practices. An incorrect approach that relies solely on anecdotal evidence or personal experience fails to meet the standard of evidence-based practice mandated by professional guidelines and regulatory bodies. This can lead to policies that are ineffective or even counterproductive, potentially increasing HAI rates. Another incorrect approach that ignores input from frontline staff overlooks critical practical considerations, leading to policies that are difficult or impossible to implement, thus undermining their purpose. Furthermore, failing to consult relevant regulatory guidelines, standards during policy development is a direct violation of compliance requirements and can result in legal and accreditation issues. Professionals should employ a decision-making process that begins with identifying the specific infection control problem or area requiring a new or revised policy. This is followed by a comprehensive literature review to identify evidence-based interventions and best practices. Next, relevant regulatory requirements and professional guidelines must be consulted. Stakeholder engagement, including input from those who will implement the policy, is crucial for assessing feasibility and identifying potential challenges. Finally, policies should be drafted, reviewed by relevant committees, implemented with appropriate training, and continuously monitored for effectiveness and updated as needed. Question 18. Compliance review shows a sudden increase in Clostridium difficile infections, CDI, across multiple units within a healthcare facility. Which of the following represents the most appropriate initial response by the infection prevention and control team? Option A. Focus on optimizing antibiotic stewardship to reduce the overall use of broad-spectrum antibiotics, assuming this is the primary driver of the CDI increase. And wait for laboratory confirmation of specific strains before implementing any isolation precautions. Option B. Immediately implement enhanced environmental cleaning protocols across all affected units and initiate contact precautions for all patients exhibiting diarrhea, while simultaneously commencing a detailed epidemiological investigation to identify common risk factors and potential sources. Option C. Initiate a facility-wide screening for CDI in all patients, regardless of symptoms, to identify asymptomatic carriers and implement universal decolonization protocols for all patients and staff. Option D. Advise all clinical staff to increase hand hygiene compliance and monitor patient symptoms closely, deferring a formal investigation until a more significant number of cases are identified. The correct answer is B. Immediately implement enhanced environmental cleaning protocols across all affected units and initiate contact precautions for all patients exhibiting diarrhea, while simultaneously commencing a detailed epidemiological investigation to identify common risk factors and potential sources. Explanation. Scenario analysis. This scenario presents a common challenge in infection control, a cluster of healthcare-associated infections, HAI, that requires immediate and systematic investigation. The professional challenge lies in balancing the urgency of controlling the outbreak with the need for accurate data collection, adherence to established protocols, and effective communication with various stakeholders, including clinical staff, administration, and potentially regulatory bodies. Failure to act decisively and appropriately can lead to further transmission, increased patient morbidity and mortality, and significant reputational and financial damage to the healthcare facility. Correct approach analysis. The correct approach involves a multifaceted strategy that aligns with established infection control principles and regulatory expectations for outbreak management. This includes immediate implementation of enhanced surveillance to identify all affected patients and potential sources, followed by a thorough epidemiological investigation to determine the common source or mode of transmission. Simultaneously, implementing evidence-based control measures, such as contact precautions, environmental cleaning, and staff education, is crucial to halt further spread. Collaboration with laboratory services, for timely identification of causative agents, and their antimicrobial susceptibility patterns is also paramount. This comprehensive approach ensures that the investigation is both scientifically sound and practically effective in mitigating the outbreak, adhering to the principles of patient safety and public health mandated by infection control guidelines. Incorrect approaches analysis. One incorrect approach would be to focus solely on symptomatic treatment of affected patients without initiating a systematic investigation into the root cause. This fails to address the underlying transmission dynamics, allowing the outbreak to potentially persist and spread. Ethically, this represents a failure to uphold the duty of care to prevent harm and a disregard for the principles of proactive infection control. Another incorrect approach would be to implement broad, unconfirmed control measures without a clear understanding of the transmission route. For example, widespread antibiotic use without identifying a specific bacterial source could contribute to antimicrobial resistance and is not a targeted infection control strategy. This approach lacks scientific rigor and may be ineffective, while also potentially causing harm. A third incorrect approach would be to delay reporting the suspected outbreak to relevant internal committees or external public health authorities. This delay can hinder timely expert consultation and resource allocation, and may violate regulatory reporting requirements for communicable diseases or significant HAIs, thereby compromising public health efforts. Professional reasoning. Professionals should approach outbreak investigations with a structured decision-making process. This involves 1. Recognizing the potential outbreak through enhanced surveillance data. 2. Activating the facility's outbreak response plan. 3. Mobilizing the infection control team and relevant stakeholders. 4. Conducting a rapid risk assessment to determine the urgency and scope of the investigation. 5. Systematically collecting data on cases, exposures, and potential sources. 6. Formulating and implementing evidence-based control measures. 7. Continuously monitoring the effectiveness of interventions and adjusting the strategy as needed. 8. Communicating findings and actions to all relevant parties. This systematic and evidence-based approach ensures that interventions are targeted, effective, and compliant with professional standards and regulatory mandates. Question 19. Stakeholder feedback indicates a recurring challenge in managing patients with suspected community-acquired pneumonia, CAP, where initial broad-spectrum antibiotic therapy is initiated, but diagnostic workup results are delayed or inconclusive. Some clinicians advocate for continuing the broad-spectrum agent until definitive pathogen identification, while others suggest narrowing therapy based on clinical improvement alone, even without specific microbiological data. A multidisciplinary team is debating the most appropriate stewardship approach for these CAP cases to balance patient care and antimicrobial resistance mitigation. Option A. Continue the initial broad-spectrum antibiotic therapy for the full planned duration unless a clear contraindication arises, regardless of diagnostic results or clinical response. To ensure complete eradication of any potential pathogen, Option B. Discontinue all antibiotic therapy immediately upon initial signs of clinical improvement, irrespective of the severity of the initial presentation or the potential for underlying bacterial infection. Option C. Narrow antibiotic therapy to a single agent based solely on the clinician's subjective assessment of patient improvement, without requiring any diagnostic confirmation or consideration of local resistance patterns. Option D. Implement a protocol that mandates a review of antibiotic therapy within 48-72 hours of initiation for CAP, with a focus on de-escalation to narrower spectrum agents or discontinuation if clinical improvement is evident and no specific pathogen is identified, supported by local antibiogram data and infectious disease consultation when necessary. Correct answer is D. Implement a protocol that mandates a review of antibiotic therapy within 48-72 hours of initiation for CAP, with a focus on de-escalation to narrower spectrum agents or discontinuation if clinical improvement is evident and no specific pathogen is identified, supported by local antibiogram data and infectious disease consultation when necessary. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for effective treatment with the long-term imperative of preserving antimicrobial efficacy. The healthcare team must navigate differing clinical opinions and establish protocols to ensure patient safety and public health. Careful judgment is required to avoid both undertreatment, which can lead to patient harm and resistance development, and overtreatment, which contributes to resistance and unnecessary costs. The correct approach represents best professional practice because it prioritizes a multidisciplinary, evidence-based strategy for antimicrobial stewardship. This aligns with the core principles of infection control and antimicrobial resistance prevention, which are central to the CPIC certification. Specifically, it emphasizes the importance of diagnostic stewardship, appropriate selection of antimicrobials based on local resistance patterns and patient factors, and defined treatment durations. This approach is ethically sound as it aims to provide the best possible care for the individual patient, while also fulfilling the professional responsibility to protect the community from the growing threat of antimicrobial resistance. Regulatory frameworks for infection control and antimicrobial stewardship, such as those promoted by the Centers for Disease Control and Prevention, CDC, in the U.S., strongly advocate for such comprehensive programs. An incorrect approach that relies solely on physician preference without considering diagnostic confirmation or local resistance data fails to adhere to evidence-based medicine and can lead to the selection of broad-spectrum agents unnecessarily. This contributes to antimicrobial resistance, a significant public health concern, and may violate guidelines promoting judicious antimicrobial use. Another incorrect approach that involves extending treatment duration without clear clinical indication or reevaluation of the diagnosis is wasteful, increases the risk of adverse drug events, and further drives resistance. This disregards the principle of de-escalation and targeted therapy. A third incorrect approach that neglects to involve pharmacy or microbiology in the decision-making process isolates critical expertise and can lead to suboptimal drug selection or dosing, undermining the effectiveness of the stewardship program and potentially violating collaborative practice guidelines. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's clinical presentation and relevant diagnostic data. This should be followed by a review of local antibiograms and established institutional guidelines for antimicrobial use. Collaboration with infectious disease specialists, pharmacists, and microbiologists is crucial for optimizing antimicrobial selection, dosing, and duration. Regular reassessment of the patient's response to therapy and consideration of de-escalation or discontinuation of antimicrobials are essential components of effective stewardship. Question 20. System analysis indicates that a healthcare facility is experiencing increasing rates of certain healthcare-associated infections, high, despite existing infection control protocols. The facility's leadership is questioning the effectiveness and cost-benefit of its current HAI surveillance program, suggesting a potential reduction in resources allocated to it. As a certified professional in infection control CPIC, what is the most appropriate strategic approach to address this situation and demonstrate the indispensable role of robust HAI surveillance? Option A. Suggests that HAI surveillance be treated as a purely administrative function, with data collection and reporting handled by non-clinical staff without direct input from infection prevention specialists. Option B. Advocate for enhanced integration of HAI surveillance data into the facility's quality improvement initiatives and strategic planning, highlighting its role in identifying systemic vulnerabilities and informing targeted prevention strategies. Option C. Recommend a significant reduction in the surveillance budget, reallocating funds to direct patient care activities, with the understanding that surveillance can be scaled up if outbreaks occur. Option D. Propose to shift HAI surveillance efforts to a reactive model, focusing resources only on investigating suspected outbreaks rather than continuous monitoring. The correct answer is B. Advocate for enhanced integration of HAI surveillance data into the facility's quality improvement initiatives and strategic planning, highlighting its role in identifying systemic vulnerabilities and informing targeted prevention strategies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare facility to balance the immediate need for resource allocation with the long-term imperative of infection prevention and control. The pressure to maintain operational efficiency and manage costs can sometimes overshadow the critical role of robust surveillance in preventing healthcare-associated infections. A failure to adequately invest in or prioritize surveillance can lead to undetected outbreaks, increased patient morbidity and mortality, and significant financial repercussions due to prolonged hospital stays and treatment costs. The challenge lies in demonstrating the tangible value of surveillance to stakeholders who may not fully grasp its preventative impact. Correct approach analysis. The correct approach emphasizes the proactive and data-driven nature of HAI surveillance. By integrating surveillance data into the facility's quality improvement initiatives and strategic planning, the facility acknowledges that HAIs are not merely isolated incidents but systemic issues that require continuous monitoring and intervention. This approach aligns with the core principles of infection control, which mandate systematic data collection, analysis, and dissemination to inform prevention strategies. Regulatory frameworks, such as those overseen by the Centers for Disease Control and Prevention, CDC, in the U.S., strongly advocate for comprehensive HAI surveillance programs as a cornerstone of patient safety and public health. This approach demonstrates a commitment to evidence-based practice and a proactive stance in mitigating risks, which is a hallmark of professional infection control practice. Incorrect approaches analysis. One incorrect approach involves viewing HAI surveillance solely as a reactive measure, implemented only when an outbreak is suspected. This fails to recognize the preventative power of ongoing surveillance. Ethically, this approach neglects the facility's responsibility to proactively protect patients from preventable infections. From a regulatory standpoint, it falls short of the comprehensive surveillance requirements often mandated by healthcare accreditation bodies and public health agencies, which expect continuous monitoring rather than ad hoc investigations. Another incorrect approach is to treat HAI surveillance as a purely administrative task, disconnected from clinical practice and quality improvement. This disconnect prevents the valuable data generated by surveillance from informing clinical decision-making and process improvements. It represents a failure to leverage surveillance as a tool for enhancing patient care and operational efficiency. Regulatory bodies expect surveillance data to be actionable and integrated into the facility's overall quality management system. A third incorrect approach is to prioritize cost-cutting measures by reducing investment in surveillance infrastructure, personnel, or data analysis capabilities. While fiscal responsibility is important, underfunding surveillance can lead to greater long-term costs associated with treating HAIs and managing outbreaks. This approach is ethically questionable as it potentially compromises patient safety for financial gain. It also violates the spirit, if not the letter, of regulations that require adequate resources to be allocated to infection prevention and control programs. Professional reasoning. Professionals should approach HAI surveillance with a mindset of continuous improvement and risk management. The decision-making process should involve 1. Understanding the regulatory landscape. Familiarize oneself with all applicable federal, state, and local regulations pertaining to HAI surveillance and reporting. 2. Data-driven decision-making. Ensure that surveillance activities are designed to collect meaningful data that can be analyzed to identify trends, risk factors, and areas for improvement. 3. Stakeholder engagement. Effectively communicate the value and impact of HAI surveillance to all relevant stakeholders, including leadership, clinicians, and frontline staff, to foster buy-in and support. 4. Integration with quality improvement. Actively integrate surveillance findings into the facility's quality improvement processes, ensuring that interventions are evidence-based and targeted. 5. Resource allocation advocacy. Advocate for adequate resources to support robust surveillance programs, clearly articulating the return on investment in terms of reduced patient harm and healthcare costs.